What are some of the risks and the benefits with weight loss surgery?
So the benefits obviously are going to be what we talked about, all the health issues that you can solve. But there are some risks with the surgery. And I talked a little bit about the actual surgical risk of the surgery already, which are going to be infection, bleeding, the leak, the pulmonary embolism that can occur, and wound infections are the other one. Some of the other things that we see in some of the patients when they lose 100 pounds in a patient who's been obese for 30, 40 years of their life, they're going to have excess skin. And one of the things that we see a lot is excess skin of the lower abdomen. So when they stand, they have all this skin excess skin hanging down.
Back. The elasticity is all gone.
Right, and it becomes a hygiene issue where they're having open wounds and sweating and that kind of thing. So some of them require other surgical procedures, like an abdominoplasty or what we call a paniculectomy to get rid of that. Also in their arms and legs, that can also occur also.
So we talked about the obvious medical benefits because obesity is associated with so many different problems you can have, but what about the mental benefits of this?
Yeah, we see a lot of our patients, they regain their enthusiasm for life.
Yep.
They become more confident of things to do. So we see a lot of that.
We did talk a little bit about the risks, so we do want to just make sure we go over them because we want people to know everything that they possibly can. Bleeding, we talked about that, surgical site infections, blockage of bowels, we didn't really hit on that.
So that's a small bowel obstruction that can occur usually after any surgical procedure.
Okay.
But it can also occur, after this procedure too.
Okay. We also have blood clots, heart attack, need for follow-up surgery, and you told me you follow your patients for a minimum of 5 years.
That's correct.
And why?
So what I tell my patients, this is not just going to the operating room and getting a hernia fixed or any other procedure that you can have. Usually we follow those patients for 5 years. So what I tell them is to treat it as an investment in their future.